it came to be, it actually started with Dr. Glenn McDonald at Newgate Mission in 2017. And what he did was actually establish really great relationships with people that were having lunch at Newgate and needed, chronic medical management. He's a nephrologist and internal medicine physician. And after establishing rapport and kind of doing medicine out of Newgate, we decided that in 2026 that we really needed to expand this initiative. There's approximately 500 people at last count that are experiencing homelessness here in Longview, and 38% of those are women. Which is also concerning. So what our initiative is to get those people where they might be and offer primary health care services to them so that they are able to manage their chronic conditions and also not utilize the emergency room services of our local hospitals for primary care purposes.
Okay, I see. But here today, you guys have temporary spaces into which people from different organizations, not a walk-through clinic, but people from Highway 80, Salvation Army, get to walk in.
Right.
And so, how did y'all get the space for this building? Did you guys just work with Longview Community Ministries?
Yes, we worked with Longview Community Ministries and were able to obtain 2 exam rooms, which we're super excited about. And then we coordinated with our community partners to make sure that we were not duplicating services and to offer members of the community the services that they needed. So we have coordinated with Highway 80 Rescue Mission today, and so those patients that are being seen today are primarily from Highway 80, and then we will work with other organizations to see those patients as well. It's really fabulous that, number one, that the members that are of the community that are currently housed at Highway 80 feel comfortable and confident in our abilities to help them meet their medical needs, and that a lot of those populations are vulnerable and have been, possibly had a really negative experience in the healthcare world in the past, and so for them to place their trust in us is really fabulous. And it's also been really busy, and we're very excited about that.
Okay, and how many patients did you guys have today?
I believe we had 13 scheduled today.
13 scheduled today,
Yes.
and hopefully more in the future.
Yeah, hopefully more. This was our first day, and so again, it takes some of the patients a little bit longer to make sure it's vetted and it's okay, and to establish that trust. The others that we have seen again at Highway 80 and at Newgate in our ongoing kind of mission work have come in today.
So also side question, tell me just a bit about these doctors so from what I know, they are just local doctors from different organizations. Is that correct? How do they get involved?
Dr. Glenn McDonald is incredibly mission oriented. He's a nephrologist at Good Shepherd Medical Center, but he's also board certified in internal medicine, and this is just part of his soul for the community, and so completely just his mission, and awesome. Deborah Bale has often been described as the Mother Teresa of East Texas, and I would definitely second that. She established an organization called Refuge International, and I've known Deborah for years, and where we did mission work in Guatemala, and that's still ongoing. But she is very active in the community and advocating for health care for our local community. And so it's just mission aligned providers who have made this happen. We are currently looking to partner with and collaborate with any of our organizations here in Longview. And really, this is one of those things that's kind of in God's hands. And this definitely is a result of that. It's been a lot of prayer, a lot of working together again with our like-minded community partners to address the issues that we all see. And I feel that there will be an eventual permanent plan.